international nurse. So I did my nursing training actually in New Zealand. I was born in the UK, but did my training in New Zealand after we emigrated as a family down to New Zealand. And after completing my nursing training, worked for several years and became specialized in critical care. And at that time came into the US and had my first assignment in a city called Memphis in Tennessee, which you may know as home of Elvis Presley, famous for a few other things, but that's one of the main things. I then moved after my assignment to Boston, Massachusetts, where I started to work with international healthcare professionals coming into the US. And that was back in, oh gosh, a long time ago. I've been in the industry probably about 27 years now and have been with Avant since 2006. And the company is in its 20th year of business. So we're celebrating our 20-year anniversary of helping international healthcare professionals migrate into the US, whether that is as a PT, an RN, or an OT. So we're very pleased this morning to be able to talk to you a little bit about the program that we offer and the support that we can provide. Let's jump in and see what we have to talk about this morning. So who is Avant? Well, we are, as I've said, an international staffing company. We specialize in the recruitment of healthcare professionals. That is all we do. And you'll see there on the slide, our team. We've grown. When I joined the company in 2006, we had 12 staff. And now both here and in the Philippines, we have offices, and we have now over 300 staff who are working with our healthcare professionals to bring them successfully into the US. So much, much bigger group that we've grown over the last 20 years. We place in all kinds of facilities across the US. We place now in 42 states. And we actually recruit from now over 60 countries. So all of the countries that Dr. Jenny mentioned this morning, the Philippines, Malaysia, Indonesia, the UAE, the United Kingdom, places like Brazil, places like, Pakistan, India, all over the world is where we get our healthcare professionals from. We place in a diverse range of facilities, not just hospitals, but also home care, skilled nursing, long-term care, outpatient facilities all across the United States. So now in about 42 different states that we do have nurses. We have over 2,000 nurses and PTs on assignment throughout the United States. And we looked at the other day, since we started the business in 2003, we have calculated that we have worked with over 5,000 healthcare professionals in changing their lives and the lives of the patients that they serve. So really a wonderful, it's been a wonderful journey, and we are excited today to talk to you about how you can begin your journey this morning. So why do people come to the US? Well, I'll tell you a little secret. I came to the US initially for several reasons, but I met a guy and he lived here. And so that was one of my motivations. So maybe for some of you, romance is in the air, and maybe somebody that you have your eye on is here in the States. But no, that's not the only reason that I came. And unfortunately, that relationship didn't work out. So, but that was okay. That was all right. I finally met my husband a few years ago, and he was worth waiting for. But if romance is part of your decision, then that's okay. So certainly give that some thought. Also for me, as a nurse working in New Zealand, I was really interested in the type of nursing and healthcare that was offered in the US. So many of the articles, the education, everything that we read comes out of the US. And so for my own professional growth, I was also interested in looking at the US to see what I could learn and what skills I could develop by spending time working in the ICU here in the US. And it really was a fantastic opportunity. I learned so much. I was able to bring my experience in New Zealand and later on from the UK and really learn and develop to be a much better clinician. And I know that that holds true for many of our PTs as well. Obviously, benefits and compensation is another great reason to come. We offer a very competitive package, not just of pay, but of bonuses and benefits that we're going to talk a little bit about this morning. As I said, the advanced technology and the skills that you can learn is also another great reason for coming. Obviously, practice-based research, and Dr. Jenny has this wonderful group that she is providing information support to physical therapists who are working all around the world, but from her vast experience now working here in the US. Your career growth, again, many of our nurses and therapists have gone on to become directors of physical therapy, directors of nursing, excellent specialist clinicians. So there are many, many opportunities for your career growth as you think about your reasons for being here. Healthcare in the US is very highly respected, and some of you may work in areas where that is not always the case. And so that is also quite refreshing when you come to the States. Obviously, healthcare has been on the forefront of a lot of news over the last few years with COVID and various different things going on. So I think truly people have come to have a huge respect for healthcare providers. And that is, a nice part of being here. Job satisfaction, I think any of you who now work in active clinical practice know healthcare is not easy, and that is no different here. There is a lot of challenges now in the healthcare profession and in the healthcare profession. But I think overall, many of our healthcare professionals find an increase in their job satisfaction for many reasons, whether that is better compensation for what you're doing, whether that is the respect that you gain, but there are many reasons that is the case. Lots of further education. Many of our therapists now, like Dr. Jenny, have gone on to become doctoral students and doctorally prepared physical therapists, masters and doctorally prepared OTs, not to mention so many of our nurses have diversified their education as well. It also gives you permanent residency in the US. I have been here now for 17 years, and I just became a citizen at the end of last year. So finally, you can become a citizen of the US once you've been here for 5 years, but for whatever reason, I just never found the time to do it. And so finally, I'm proud to say that I am now a citizen of the US, and that is something very, very possible for you. Also, for your family, we provide family-based sponsorship. So if you are married and you're coming with children who are under the age of 21, that is also an opportunity for them. You can travel as a family. Many of those positions in the Middle East are single status positions, and the US gives you that opportunity to bring your family with you and make a new life here in the US. So for whatever your reasons are, give it some thought. Be very clear on what those reasons are. There will be days when you wonder why you made the decision. And so it is great to be able to have a very clear idea of exactly why you want to be here in the US. So those are just some of the reasons that you may think about. So we're going to talk a little bit now about the general requirements for PTs, physical therapists, to come into the US. You must be educated and licensed as a PT and currently working in your field. We will take experience from all different genres. So whether that's home health, whether you're working in your own business, whether you are working in a clinic or of course in a hospital. We also do have some positions that provide for clinical instructors to also be considered. So really, if you are working, in any area of physical therapy, we are open to consider that. You must be working full-time, at least 36 hours a week, and you must have a minimum just of 6 to 8 months in order to be considered for the program. You must remain employed until you are deployed into the US. The clients are really looking for that continual physical therapy experience. So by the time you come, depending on what it is that you have to do, you will have about 18 months to 2 years of experience by the time you're actually deployed to the US. Now, this is a busy slide, and many of you know how much the requirements have changed over the last few years. And it now is a requirement that you have a minimum of, you can either have a combination of a master's degree and a bachelor's degree, but in most cases, you now are required to have a doctoral of physical therapy in order to be considered to come into the US. So if you have not already taken and passed the NPTE, that would also be a requirement to do that. I'm just moving my little pictures so I can see the slide. There we go. And you must meet coursework tool 6. So those of you who maybe are not familiar with the process, fccpt is the main organization that credentials physical therapists to come into the US. So for nurses, that company is CGFNS, and for physical therapy, it is fccpt. And they set a coursework standard in line with the educational requirements for the US. And right now, that standard that you must meet is coursework tool 6. So the applicant must meet the requirements of not less than 170 semester credit hours as a prerequisite. The minimum course requirements in and of themselves do not necessarily satisfy the requirements of the first professional degree. The applicant must have completed sufficient credits to satisfy the requirement for a minimum of a post-baccalaureate degree program. The applicant must also meet any jurisdiction-specific requirements. And those jurisdiction-specific requirements are related to the board that you may be licensed through. So in most cases, coursework tool 6 will be met by one of the following. Either you have your bachelor's of physical therapy plus a master's in physical therapy. You may have a bachelor's in physical therapy or a transitional doctor of physical therapy, which I know there are now several programs in the Philippines that offer that. And or you must be a full DPT graduate. So those are the 3 combinations that meet the requirements in most cases for coursework tool 6. Now, even if you've met the above, there may be some additional coursework that you need to do in order to meet coursework tool 6. And fccpt will be the one to guide you through that process. And we just had a therapist who was a bachelor's prepared therapist. She had done her transitional doctoral degree here with an organization in the US. And she did have a couple of credits that she still had to make up. And we did that with her through PRI in the Philippines. And so that is still available for any of those credits that may not be included in your program. So hopefully that makes sense to you and is clear. So this table, just to give you a little bit more information on the various different options that you have. So if you have a bachelor's degree with a coursework tool 5, so that was the standard for a long time, okay? Now, if you are already NPTE licensed and you hold a current type 1, so that is inclusive of your visa screen, you can still come into the US. But you must already have NPTE and you must already have your type 1 visa screen. We can help renew that if that is required, but it must have already been issued. Obviously, in line with that, you would have also completed the English language programs. In most cases, TOEFL is what you're going to do. And that is a requirement of a 63 combined score with a 26 in speaking. Now, because most states have moved from the coursework tool 5 to coursework tool 6, you may be limited if you have this combination in some of the states that you can work in. So we would look at all of that as you join the program. The second option is if you have a master's degree. If you just have a master's degree, you could either have a coursework tool 5 or 6. If your education is equivalent to a coursework tool 5, again, you must already have your visa screen and you must have passed NPTE. And again, the TOEFL is part of that. If you have a bachelor's degree with a transitional DPT, you may in fact have a coursework tool 5, but in most cases that will translate to coursework tool 6. And again, with this, as with the other combinations, you must already hold your visa screen if you have a coursework tool 5. I get many comments on Facebook from physical therapists who only hold a bachelor's degree. And you can get through NPTE. For example, many of them do NPTE through New York, because New York will still accept a coursework tool 5. But the problem is you're then going to get stuck. You're then going to get stuck because you cannot now get a visa screen, a type 1 FCCPT certificate, or a CGF&S visa screen without holding that DPT or that coursework tool 6 equivalency. So it is really important that you know that. You certainly can spend time and resources doing NPTE if you have that bachelor's degree through, especially New York is the most common one I see, but you are then going to be stuck and you are then going to have to make some decisions about what it is you're going to do in order to meet that coursework tool 1 requirement. So the safest way right now is either the bachelor's degree plus a transitional DPT, or if you are going to do a straight DPT, then that will obviously give you coursework tool 6. You will get a type 1 certificate, you'll do your TOEFL, and you will obviously be able to work in most states in the US. The only states that may be precluded for you would be those states who perhaps have a different English requirement than is the standard. So again, that is really the combinations that work for getting your certification and your credentialing to come into the US. So it's not as simple as it used to be. And you do have to be pretty committed and have some resources to be able to do that. So again, just to run through for the type 1, so FCCPT again is the credentialing company. They do the best thing to do if you are confident you're going to meet the requirements is your type 1. And the type 1, you must have a bachelor's degree or higher in physical therapy, and you must have a master's degree or higher in any subject. So you may have a bachelor's degree in physical therapy, you may have a master's degree in something else. That is also something that can be considered. Transitional DPT or post-professional degrees offered by accredited universities, and there are a couple in the Philippines or in the US, and there are several transitional doctors programs that you can do. You must be eligible to practice physical therapy in your country of education and must be licensed in that country. And you must be able to pass TOEFL and qualify for a TOEFL exemption. The visa screen certificate is issued only with verification of bachelor's and master's degree or higher, verification of all licensure that you've held since graduation, verification of your TOEFL or TOEFL exemption, equivalency to coursework tool 6, and minimum of 210 total semester credits. And there is a link there, and we can put that in the chat if you would like. And that will then take you to the FCCPT page so that you can review that at your leisure. So lots of information there about the requirements. So what do we offer for you? Well, we do offer either an EB2 or an EB3 green card. So EB simply stands for employment-based, and the categories that we use and can use are depending on the education and the experience that you have. Same outcome, you still get a green card. Processing is exactly the same. Right now, EB2s are actually slightly retrogressed, whereas EB3 visas are current. So we evaluate the best course for you as you join the program, and then we'll file you according to the best opportunity for you. We do offer a competitive pay rate. Physical therapists do earn well here in the US, and we need to be competitive in that regard. Pay comes down to several things: experience. It also comes down to the location that you are going to work in. What is the cost of living in that area? And then we will come up with an appropriate wage for you. We do offer a shorter contract because therapists come with NPTE, FCCPT already done, and so it is a 5,200 hour contract. And the great thing about that contract is every hour that you work comes off your assignment. So if you do additional time, additional visits, all of that comes off your contract term. And so although it is a per hour contract, so 5,200 hours, you can, in fact, and that's about 2.5 years if you were to work just full time with no additional overtime, but many people run through that contract much faster than that. We do offer a $6,500 sign-on bonus for those with NPTE Pass and FCCPT Type 1. And you also get an additional $4,000 while you are on contract with us. So a total of over $10,000 in bonuses. We also provide you with an increase in your hourly rate at several stages of the agreement. The first is $1 an hour increase at a year, or 2,080 hours. The second is another $1, so at 4,160 hours, so about the 2-year mark. We also have a great referral program, and we can again put the link to that referral program. So if you know therapists, maybe today you're not sure if this is for you, but you have friends who are interested, then you can refer them to us, and we pay a referral bonus when that person arrives and starts work for us here in the US. So lots of opportunities to refer your friends if you would like to do that. So that's one of our therapists heading over to the US, and he is working, I believe, in New Mexico. I would need to double check that, but I think he's working in New Mexico. All right, so let's talk a little bit about nurses now. So nurses, again, you must be licensed to be a nurse in your country of training and also in the country that you are currently working in. Now, we are now, in the last year, have taken the opportunity to invite new grads to join our program. We used to have a requirement that you had to have at least 2 years of experience, but we now will consider those of you with less experience than that, and also new graduates joining the profession. Obviously, NCLEX passes are eligible to apply, as well as those without NCLEX. We do have an NCLEX program that provides a great first-time pass rate. So if you need NCLEX, then that does not need to stop you applying to the program. Now, anyone else who is not a new grad, we do ask that you have at least 6 months of experience, and you need to be working in a hospital with at least 20 beds. We used to have a requirement that it was 80 to 100 beds, but we understand there are many, many great nurses working in smaller facilities, and so we have decreased the bed requirement. Now, most of the jobs that we have, unlike therapy, most of our nursing jobs are actually in hospital environments. We also do place in home care for nursing. We have some skilled nursing, some nursing homes, long-term care. We have very little outpatient, excuse me, for nurses, but we do have home care. And most of the hospital positions are in those acute care areas: med-surg, critical care, ED, OR, psych. We have many, many different opportunities available for our nurses. Now, we do have, again, new opportunities. So new grads with no experience. You must have graduated in the last 2 years for that to be available to you. If you have NCLEX already, but you are not currently working bedside, perhaps you're working in a BPO, perhaps you're not working at all, we do also want to hear from you. We do have opportunities where we can assist and consider you for the program. In that regard, you must be able to return to a working nursing setting within 120 days of signing the contract, and you must be able to work a minimum of 24 hours. So some of our nurses that are working BPO, they continue working BPO, but they also work some shifts as a nurse during the time they are waiting to be deployed. We would also review that opportunity of work with you, and your placement here in the US is more likely to be in a non-specialized area. So for example, probably going to be working in a medical surgical floor if you come with less experience. So those are some of the opportunities that are new and that we have available for you. So any further questions on that, feel free to put them in the chat, or we will tell you how to apply at the end of the process. So this process really is very similar for PTs and nurses, but this is the process for nurses. So essentially what happens first is you would apply. We would then interview you. You'll have a behavioral interview and a clinical interview to look at your skills, and that will be with one of our US-based nursing recruiters here. You will sign a contract if offered a position on the program. You'll have plenty of time to review that. Please, please, please do not sign anything you have not read. I talk to nurses and therapists all the time. Well, I signed the contract, but I didn't really read it. So I didn't really understand what I was committing to. So be very sure that you've read everything before you sign. We then go through a process of collecting documents. If you need to take the English exams now for nurses, not only IELTS and TOEFL, but now OET, PTE, and a few other exams are available. Many of our nurses are moving to take the OET, but OET, IELTS are still the most popular that you're going to see. So some people take that prior to starting the program, and some people take that after their NCLEX exam. So it really depends on your own individual situation. If you need the NCLEX with us, you're going to go into the NCLEX program. And many of you know the NCLEX is changing in April. It is changing to what is called the next generation NCLEX. And we have been preparing nurses for next gen probably for about the last year now. So we are ready with the new content. Our study program is designed to help you pass next gen, and that takes about 6 or 7 months. Not only because you have a lot to learn, but also because the credentialing process to get you to the point of sitting NCLEX also can take about 6 or 7 months. So for our therapists, this is where you would begin. We would then, so therapists and nursing, once you have your US license, that is when we can go ahead and file the permanent residency green card for you and your family. In most cases, that process is going to take about 8 to 10 to 12 months. The immigration service is sometimes unpredictable, which again is why you want to be with a company who has the experience in what they are doing. It is complicated. There is timing involved. There are things that have to happen in a certain order and documents that you need to gather ahead of time. And so we work very closely with you during that time to make your green card process as fast as possible. So again, both for nurses and for therapists, we also have what is called our clinical preparation program. There are many, many differences in nursing and therapy practice in the US compared to where you are currently working. And we want to use the time that you're waiting for your green card in order to get you ready for your practice differences here in the US. And so we have developed a program that you complete while you're still at home. It is online, lots and lots of great resources. And that program begins to get you ready for living and working in the US. As your green card process moves forward, we then start your client placement. So we will reassess your skills at that time. We'll talk to you about where it is that you want to go. Where do you want to be? Do you have family in locations? Do you have aunts and uncles, friends? And often we are able to match you with your location of choice, and then we will confirm that placement before your arrival in the US. Typically that happens 3 to 6 months before you are going to arrive here in the States. Now, once you have your visa, you've gone through the green card process, your visa has been issued, you would travel to the United States. And your first stop is going to be here with us in Orlando. We are not far from the airport. We're about 45 minutes from Orlando International. You will be picked up at the airport and transported to our corporate housing. You're going to be with us here in Orlando for 5 to 6 weeks. And that 5 to 6 weeks is a really busy time. That is when we start to do skills validations. You're working with our instructors here in our skills labs. You are doing any certifications that you may need to do, your basic life support, advanced life support, TNCC for some of our nurses, and you are finding your housing in your location of placement. You're choosing a car that you're going to purchase through a car purchase program we offer, and you are getting ready for your assignment. So you will be with us for that period of time, very busy few times. We house you in beautiful apartments across the road from our offices, and you will be with us for that period of 5 to 6 weeks. Now, once you are ready to go, and once you have finished all of the clinical and the cultural information that we have for you, we will then fly with you to your placement location. You won't have to do any of this on your own. We have a team of transition specialists who will fly to your location, and they will help you get everything organized to move into your new home that you have chosen while you're here in Orlando. They will spend about a week with you. They will orient you to the area. They will introduce you to your clients, contacts. They'll take you and show you where you're going to be working, and you will be getting your home organized for you to start work. So then you start assignment, and our support for you does not end there. We stay in close contact with you throughout the term of your assignment to make sure that everything is running smoothly, you've oriented well, you're getting the support from the client that you need, and you are thriving in your new environment. So the whole process, again, depending on what you join us with, can take about 18 months to 2 years. It really depends whether you need NCLEX, you come with NPTE, and also green card processing is slightly dependent on your country of birth. Typically, in most cases, India is still retrogressed back to about 10 years, and China, but all other countries are current and moving forward in the green card process pretty smoothly. So that gives you a little process overview. So just to talk a little bit about our offering for nurses, if you join us without the NCLEX, your contract will be slightly extended. It will be 6,240 hours, which working full-time at 40 hours a week is about 3 years. But again, remember, every hour that you work comes off your assignment term. So if you work overtime, which many of our nurses and therapists do, those hours all add towards your assignment term. If you join us with NCLEX, much like our PTs, your contract will be 5,200 hours in length. Again, competitive salaries based on your skills, your experience, your education, and the location that you are assigned to. Right now, we have a bonus for NCLEX that is $10,000. So if you join us with NCLEX, you will have access to that bonus opportunity. We also do, as we do with our therapists, offer on-contract bonuses as well as you go through the process. For both our therapists and our nurses, we also offer a full package of benefits. Really important here in the US that you have medical insurance, that you have life insurance, dental insurance, malpractice insurance, and all of those are covered by Avant. We also have a great retirement program that you have access to within a very short time of joining our program. Workers' compensation, also important if you are injured on the job. There is insurance that covers part or all of your salary while you are unable to work. Paid time off, and we do offer ongoing educational allowances as well during your assignment, both for our nurses and for our therapists. So lots of benefits there that you have access to. So let's take a moment to see what questions you have. Let's see. Q&A chat. Oh, no questions. Oh, you guys are taking it easy on me this morning.
There's a question, Les, but I just answered Sam, so it's on the answered part. So I can definitely verbalize it with you, and then you can iterate it again.
Right.
Are we on the QA now? Okay.
We are, yes. Yeah.
Okay, wonderful. All right, thank you so much, guys, for listening. So let's go on the QA. Definitely, you can put all your questions on the QA and also the chat. I believe you can raise your hands if you have an option on that, and definitely I can allow you to talk because there's an option for that. All right, so let me